everybody, it's Lana, and I'm back here to talk some more. Hope y'all like my speaking voice. So, now, either you have lupus or you're concerned about someone who does or you just want the information. So, next up on our roster here is medication. If you're into modern Western medicine, medication will definitely be involved in your situation. We are going to address natural remedies, but not in this video, so definitely come back, and I definitely will let you know when we're going to do that. So now we're going to talk about medication here in the United States. Now, initially, when I got diagnosed, that was 13 years ago. There were not very many medications, so anti-malarial drugs like Plaquenil, and which is still being used, were one of the only drugs that were able to be used, as well as what they call NSAIDs, non-steroidal anti-inflammatory drugs. NSAIDs are most commonly pain relievers, Motrin like ibuprofen, Tylenol, naproxen, Aleve, pretty much pain relievers, but also they lower the level of inflammation in your body. And when the level of inflammation in your body is lower, it tends to do less damage in regards to the systems of your body. Inflammation tends to cause things like fever. If you have many fevers, it can burn out tissues, it can burn out vital cells, it can burn out brain cells even from the amount of times you overheat or how much you overheat, all from inflammation. So it's very important to keep that under control. Also, anybody who has Plaquenil, this is very important because I didn't honestly understand this concept for a very long time, and at a later date I did pay for it. With Plaquenil, it is a very slow working drug. When I say slow, I mean like years slow, but you have to be persistent with it. If you take it regularly as you're supposed to, it will definitely help decrease the amount of flares. For the flare that you do have, it will help decrease the severity. If you do have tumor lupus or anything that affects the skin, it does tend to help with the skin breakouts. It tends to minimize them as much as possible. And it has the least side effects with the most benefits. Most people don't report any side effects from Plaquenil. Currently, I take 400 milligrams a day, and I split it up between 2 pills, one in the morning, one in the evening. I don't feel nauseous from those pills. I don't feel sluggish. I don't feel sick. And honestly, they're just not a big pill. Even in generic form or brand name, they're a very easy pill to deal with. So, please, if that is something that you are prescribed, I know we would all like more rapid results, but this is something that you have to stick with in the long run. Now, next up, the next medication is prednisone. Prednisone is a steroid. Now, as we all know, steroids definitely make you gain weight. That is one of the ways that a lot of people notice or can recognize another lupus patient because of the steroids that you are given to suppress your immune system. It tends to make you put on weight, and it also changes the shape of your face. As everyone noticed, my face is relatively round. I am currently on steroids due to a flare, so my face is round. But in future videos, or again, if you know me personally and have looked through any pictures of mine, you notice that my face is not always so round. My facial shape has changed. Part of why the steroids are needed is because of the overactive immune system. Steroids do break your immune system down. Now, you would think, why would you want to do that? Because you're going to get sick with no immune system. Yes, that is true. But the reality is, we don't have very many other options. So, if you deplete your immune system, which was already overactive and fighting against itself, the only thing you have left to fight is any intruders. So, now your immune system is not fighting against itself because you're on this prednisone. So, all you have to do is take precautions. Get your flu shot, wash your hands, stay away from as many germs and things as possible. Now, this is not a long-term fix. The weight gain can be detrimental to you. The lack of your immune system can be detrimental because even though your immune system may be overactive and doing damage, there are still parts that are doing positive things, and you need that. When you are what they call immunosuppressed, which comes from anything that suppresses your immune system for more than 6 months, when you're immunosuppressed, you become at risk for a lot of other really bad situations. If you even catch a cold without an immune system, a cold can be deadly. The flu virus can be deadly. Even something as simple as you getting a cut and it not being treated properly, it can travel through your blood in ways that it normally wouldn't because there are no immune system factors like your white blood cells and your antibodies to fight off whatever germs you come in contact with. And this is where things like amputations may come in from bad, severe cuts and injuries. This is where sepsis may come in from being so many germs being allowed into your body. And if you're not sure about sepsis, sepsis is a whole body type of infection which can potentially kill you. So you definitely do not want to do that. Another medication that is a steroid is called methylprednisolone. It's pretty much the same thing, but it lasts a longer period of time in your body, and it is slightly stronger. So with that, the weight gain will be faster, and it definitely will be more significant. So you don't want to have to go to methylprednisolone if prednisone is working for you. But to be quite honest, you don't want to do either steroid anyway. Now, if it's getting more severe, there are more medications. One is methotrexate. Methotrexate is a small pill. It's very easy to take, but the side effects definitely become more severe. Nausea, vomiting, diarrhea, sometimes hair loss. There is more severe and it's very intense. And it does take your body a while to get accustomed to it. Now, I'm going to tell you, I have had methotrexate before. And it was a very hard drug to get used to. For a small pill, it packs a punch. Now, with methotrexate, again, it's another drug that can suppress your immune system. And for some people, even though it is strong, the benefits outweigh the risk. So, it can help you suppress the immune system enough that you can go forward through your daily activity with less fatigue, less joint pain, and less of your symptoms, even including your skin symptoms. Now, next is something that is very new and not everybody is trying because it is a microscopic type of medication. So everybody's not familiar with it, but rheumatologists are definitely trying to use it more going forward, and I have had it. It's called CellCept. Now, what CellCept is about, it can be between 2 to 5 pills a day. And what it tries to do is not compromise your immune system as much as steroids and other drugs. But it tries to change the actual microbiology that's going on in your body so that you can feel better without so many side effects. Definitely causes nausea. Definitely does. But, I'm going to be very frank. I didn't do well on any of the drugs except for steroids and the next drug that I'm going to speak about, which is very hard to get over. So, for me, the nausea really, I didn't like it. But what I did find helped, if you can stomach this, is ginger. If you can drink ginger, eat ginger, find it in a candy, like in its rawest form that you are able to handle, just carry around a little bit of ginger and try to just maybe suck on a ginger candy, chew a ginger candy, have ginger in some water and drink it, or even chew a piece. And it does help significantly with the nausea in my experience. And definitely drink a lot of water and not too cold. I find that if you drink your water a little too cold with your medication, sometimes it aggravates the nausea a little more. And if you do find yourself with the nausea to the point that you are throwing up, remember that you do have to rehydrate yourself with more than water. You need electrolytes, you need sugars, you need a lot of different things. So if you can stomach Gatorade, definitely try it to get past the nausea. Now, this last medication is very hard to come by, and it just recently got FDA approved. Now, when they were trying to approve it, I at the time was going to the Albert Einstein Medical Center in the Bronx, and I decided to join a blind study. This was about 8 years ago. And one of the things that this blind study was talking about is the effect of T and B cells on the human body. And with that, this infusion is supposed to change how your B cells react in your body so that it doesn't immunosuppress you, but it does have an effect on your immune system in conjunction with you taking steroids or Plaquenil so that you can lead a little bit less of a, pretty much a medication controlled life, and you can get away from the immunosuppressiveness of the other drugs, and you can just pretty much get back to your real life with a lot more control over your lupus. Now, one of the big warning labels on this is that they are not sure how this works in African American, which is very sad because a lot of the population who have lupus is African American women. Men do get it, but not as much as women. And women tend to suffer more severely from it, especially African American women. Nobody knows why, but these are the facts that are written down the way that they are. I personally, after the FDA approval of this medicine, which is now called Benlysta, which is available only by IV infusion only, I personally had to fail on at least 3 medications, which I did, which created pretty much a very long going flare. And after I failed, then my insurance would cover this Benlysta, and then I had to go for a monthly infusion. And even at that point, I had to be genetically tested to see what percentage of my blood comes up as African American. Now, my whole life, I have been raised as what we know as a black woman. Now, after genetic testing, being that the testing came back saying that I was less than 50% African American, my insurance did let up, and they did arrange all of it for my medication to be delivered to an office where they would administer it to me, and they would watch it monthly, and then they would send the result to my doctor and let her know how much I had. And this is also based on weight, again, so you have to be at your doctor as much as possible to be in control of what is given to you. Now, initially, it did work out very well, and it had the least amount of side effects, and it did allow me a period to get off of steroids, which was definitely really great for me. So, 1 infusion a month, no steroids, 2 to 3 pills a day. That's awesome. There is a very big leap in lupus medication. So if you can get this approved and it truly works for you, it's pretty much like getting a needle, and it's very much a wonder drug for the time that it does work for you. Now, it may not work for the duration of the time that you have lupus. Myself, I was only able to do a year of it before my body did create a resistance to it, and I don't use it anymore, because for the amount of time that the infusion takes, which is about an hour, and the amount of cost that it had to my insurance, which was about $2,000 a month in deliveries and the actual medication, it wasn't worth it for what the blood work was showing. So, I definitely got off of it, and I had to go back to the steroids to just try to at least get the flares in control. So right now, that's all the experience that I have in medication. If anybody have anything else, that they're dealing with, we can talk about it. I'm definitely going to talk about pain medication in a different video, because there are a lot of pain medications, and they definitely need to be touched. And there are a lot of pain therapies that we definitely can touch. I'm going to talk about that in another video, so please don't think I forgot anybody, because if there's anything I know about lupus, I do know that joint pain is very real, and just genuine pain for no reason is real. So I will come back to that in another video. You can like this, share this, comment on this. Going forward, we can talk